I'm Congressman John Duarte. I represent the 13th Congressional District of California in the U.S. Capitol in Congress. And so good morning. I'd like to welcome everyone and thank the United Health Centers for hosting here in Huron as we introduce H.R. 9942. We just got that number this morning. We just filed it this morning, which is a bill to stop valley fever. As a farmer in our valley, I've seen firsthand the impact of valley fever has had on agricultural communities across the valley. Since taking office, I've worked with the Democrat and Republicans on the Valley Fever Task Force to improve awareness and find a viable vaccine. The impact of valley fever is growing, and we need this legislation to create a vaccine now. Valley fever has seen a staggering 761% increase in cases across California since 1998. With already more than 7,000 cases this year. Based on the current data, California is expected to surpass 10,000 cases of valley fever in 2024, though the actual number is likely higher due to reporting delays and underdiagnosis. Valley fever cases can occur year-round, but in California, cases tend to increase in September and peak in November during and after the harvest season in the Central Valley. A 2021 California Department of Public Health study found that among cases with available race and ethnicity data, valley fever disproportionately affects Hispanic and Black individuals. I've got a lot of statistics here that we can recite through, but the totals in California, mainly centered in the Central Valley counties, from San Joaquin County up north to Kern County in the south, were in 2022, 2,243 valley fever cases. In 2024, so far, we're not done with 2024 yet, and we're still heading into the peak season. We're already double that at 4,331 cases identified. The Valley Fever Awareness and Vaccine Development and Manufacturing Act of 2024, now H.R. 9942, is focused on supporting the development of a human vaccine for valley fever by 2034. It would establish a federal vaccine coordinator. It would require a national strategy to be established to guide development, licensing, and manufacturing of a valley fever vaccine. It would authorize $50 million for federal grants and contracts to advance vaccine research and manufacturing, prioritizing projects in clinical trial phases, the expensive part, or an initial manufacturing status. And it would establish a voluntary Valley Fever National Registry to improve valley fever research capabilities and awareness. Now, I'd like to invite some distinguished guests to provide their insight on valley fever and this important legislation. We're grateful to have valley fever patients, advocates, and public health experts who took time out of their busy schedules to advocate for the importance of combating valley fever. So first, I'd like to hear from Dave Lucchini, Director of the Fresno County Department of Public Health. Dave, please. Come on, Congressman. Good to have you here.
Thanks, everybody, for coming. Obviously, I want to thank Congressman Duarte for this exciting bill. Thank you, United Health Centers, the mayors here of Huron-Coalinga for welcoming us. Valley fever is something we've been following for more than 20 years, and we've been seeing it grow. This is a significant public health issue, especially on the west side of our county and the west side of the valley. A lot of people have been getting it that don't realize it. 40% are asymptomatic, 60% have symptoms and sometimes don't get screened for it and appropriately treated. And so we need better tools as the fly keeps coming at me. We need something for flies too. No, just kidding. So just this year alone, we have 13 deaths that are on our death certificates, Fresno County, that show valley fever contributed to the person's death. Last year was 12. So this is a serious illness, and it continues to grow. When we were talking about valley fever 20 years ago, it was the hotbeds of Kern County, Tulare, Kings, Fresno, and Arizona. Now it's most of the San Joaquin Valley. It's going up. Even I see north parts of the valley seeing cases. You're seeing it in Nevada, New Mexico, West Texas. This is going to continue to grow with the weather changing, the hotter summers, the soil. This fungus is saying, yeah, we'll keep going. So we need better tools. And coming from public health, we know one of those best tools are vaccines. Vaccines have helped take out a lot of past viruses and bacteria that have impacted the health of our community. And now's the time to get one for valley fever. So thank you for bringing this up.
Dave, thank you. Thank you, Dave. And valley fever is a fungal disease. Makes it a little unique, but I think we're up to it. The technology is in place. We need to apply it. Next, I'd like to hear from Sarah Bossi, Director, Fresno County Department of Public Health. Sarah? There you are.
Good morning. Good morning.
One go.
Thank you, Congressman Duarte, for your public health vision and leadership. I'm Sarah Boss, the Director of Madera County Department of Public Health, and I'm pleased to join you today to highlight this important public health issue. The number of cases of valley fever in Madera County have tripled between 2020 and 2023, and that's staggering. Spending their days in the fields today, our valley farm workers are the most vulnerable to valley fever. But with frequent drought years and the increasing rate of infection that David described, I expect we'll see more infections in the general population. And so this is a concern for us all, especially in the Valley, in the years to come. So I commend Congressman Duarte for his leadership, as well as the Valley Fever Task Force and the bipartisan co-sponsors of this bill in bringing forward this plan to deploy a vaccine for valley fever. Thank you.
Thank you, Sarah. Thank you very much. Next, I'd like to invite up Jose Manny Ramirez, Mayor Pro Tem of the City of Coalinga, and a valley fever patient. Manny, there you are.
Good morning, everybody. Manny Ramirez. I'm the mayor pro tem from Coalinga. Also grew up in Huron. Bienvenidos. Gracias a todos. Thank you to United Health, Congressman Duarte, to everybody that's right here. I've been actually, a survivor. When I got valley fever was in 2008. Sorry about that. But we do need a lot of. I'm glad that everybody's focusing on early detection. And now that there's a vaccine coming up, but early detection should be an importance. A lot of tools, trees, a lot of things that we could prevent it. So we need to use and utilize all these tools. A lot of people get valley fever and they end up worse than I do, or end up worse than another person. We need to also focus as a disability, because it does limit a lot of patients with this. Me being a survivor, it did give me a lot of problems. It's still giving me a lot of problems. And early detection and having insurances detect it early, instead of just because they detected mine as asthma, but then I got sick, I got hospitalized, and it comes out as different. Being a survivor out of it, being somebody that got it, my son lost his mom to valley fever at 26. So it does impact a family, it does impact the community, and with everybody joining as a team, this is gonna prolong, and it's gonna be a great focus. Thank you so much.
Thank you, Manny. Thank you very much. Next, I'd like to bring up Mayor James Horn, City of Coalinga, to discuss the impacts on rural communities. Mayor Horn.
Hello, everybody. James Horn, Mayor, City of Coalinga. Some of the impacts on this valley fever has been, it's hit Coalinga pretty good. So we actually have, I'd say, between 200 and 500 cases of valley fever just in Coalinga alone. Not including the state prisons that we have just outside of town. A lot of it is the new weather changes. A lot of farmers are actually removing trees. There's also different stages of this valley fever. So, for instance, my father-in-law, his only agitates about once every 2 to 3 years, and it's real similar to an asthma attack, but it hospitalizes him for a few days up to a week. One of my daughter-in-laws as well has it, and she has to go in for special treatments every 3 to 4 months. And there is no cure. If there was a cure, we wouldn't have this issue. This valley fever, it's nasty stuff. It actually kills the lungs. A lot of people that have it pretty severe, they actually have to have pieces of their lungs removed, including Mayor Pro Tem has also had some pieces removed because it's dead. It's prevented him from being able to breathe correctly. So getting a vaccine is going to make a big difference. If they can catch it ahead of time and kill it, then a person has a better chance of living a better life and not having to worry about that sickness anymore. So thank you.
Thank you, Mayor Horn. Finally, hometown mayor, Mayor Ray Leon, City of Huron, please.
Buenos dias. Good morning, everybody. Thank you for joining us on this beautiful day in the heart of the valley. My name is Rey Leon. I'm the mayor of the city of Huron. My father arrived here in 1951 as an orphan from Michoacan, undocumented, and we are still here making sure that the quality of life of farm worker families and all the residents here in this community are living the best life they could possibly live, and that's why I fight and that's why I serve. I am also a valley fever survivor. And the big problem with valley fever is that it's everywhere in the region. It's a huge impact on farm workers who toil in work in the fields surrounding the city of Huron and this county. And it so happens that Huron has the highest rate of adults with asthma in the county. Now I'm thinking and wondering how many of them are actually valley fever after hearing Mayor Pro Tem Ramirez's statement. So there needs to be much more resources within the system to be able to identify or help doctors learn on how to diagnose valley fever early on. Because many doctors think it's something else, and by the time they come around to actually treat it, you are in a way worse situation than you would have been if they would have treated it, identified it early. So that's a waste of resources for the state. That's a waste of resources for our country, and that's a waste and a harm to the health of the people. Valley fever is an impact to not just health, but to economy. And if you are a family that is very low income, Huron being one of the poorest cities in the state of California, valley fever is definitely not our friend. It is certainly our enemy, and it is something that we need to get through and overcome. The vaccine is part of it, for sure, and we do need resources to figure that out. And there's also other prevention mechanisms like particulate matter mitigation in agriculture. That's something that is exempt currently at the federal level, and I think Congressmember and I will have a good discussion about that. There's other solution pieces that we could introduce and move forward to make sure that the most impacted and the most vulnerable families in the San Joaquin Valley are being attended to, protected, and honored as the food chain keepers of this nation. But thank you, Congressmember John Duarte, for accompanying us here in our beautiful community. And please take a cruise and see all the changes happening in Huron. Our plaza's coming up. You know, every community needs its sala, right? And so thank you very much for giving me the opportunity to participate.
Well, thank you, Mayor Leon. And you're absolutely right. Farming practices as well as our water policy, stabilizing the soils, farming our farms, and making sure we have ways to reduce dust and air pollution in our operations. Very, very important. We'll be happy to work with you on that now and going forward. This is a bipartisan bill. I don't have my list of bipartisan co-sponsors with me, but I regret to say, but Jim Costa's on this bill with us. David Schweiker, David Valadeo's on this bill with us. I know there are at least 2 other Democrat co-sponsors. This is a bipartisan bill, and we will provide that list of co-sponsors to the media because they deserve the recognition. They're looking forward, and they're full partners in this. I just want to finally then thank all of our participants today, all of our visitors and viewers today. Thank you for joining this important press conference, and thank you for making this a great event. I couldn't be more proud than to represent the 13th Congressional District, and I will continue to do it with H.R. 9942 and other bills that make a difference here. Thank you.